time. Now, I'm sure many of you will know that in 2004, Ghana implemented what was the envy of many, especially in the sub-region, an attempt towards a universal health coverage under the scheme, National Health Insurance Scheme. Well, since then, it's had its ups and downs. But this latest, freshly minted CEO is my guest, Dr. Da Costa Abuaje. You're welcome, sir.
Thank you, Raymond.
I hope you are doing well.
I'm fine. Yourself?
How is the office treating you? I'm good. How is the office treating you?
Thank you. Well, I just came in. I was sworn in, I think, last week, Thursday, by the board. But as you know, it's one of the most topical authorities within the country. And not only the country, but across the world.
Yeah.
Because I think we are also a model for other countries in terms of they look up to us. And many countries come here to study. So we've been having calls for countries even coming in to just tour and learn from us. So it's okay.
The Social Services Network review of social protection programs sometime in 2009 indicated that the NHIS was the biggest social protection program in the Republic of Ghana. Do you think that today we can still say it has lived up to that name?
Okay, thank you so much. So I think, yes, I'll say yes, because it's work in progress, okay? So for any insurance scheme, there are models for it to survive. And this is why we have actuarials, because you always have to look at it, the actuarial impact of the disease burden vis-a-vis, obviously, what it can cover. Now, like I told you earlier on, this is my area of specialization, is what I studied. Now, I've noted some gaps, and it is these gaps that I think with just some small efforts, Ghana can obviously address them, and with my leadership, I'll take them on board. What are some of these gaps? So I've noted that within the primary healthcare settings, you know, the insurance scheme in Ghana actually fund primary healthcare. And let me emphasize that we fund primary healthcare.
It's important. We'll get into the details of that and why that's relevant, and whether or not that's what it's set out to do 100%, and whether it's on course to doing so. You also mentioned some gaps that from your end you have identified. We would probe all of that. And I'm happy, because the question I was going to ask you was that, what makes you think that you are the right guy for the job? That was the question I was going to ask you directly. Of course, we've had so many people lead the Health Insurance Authority, but what makes you think that you are the most, if not most qualified, you are the right guy for the job at this time, more importantly?
Okay, thank you. So I think I'll give you some background. So I studied the National Health Insurance Scheme in Ghana at a PhD level. So in 2010, I started collecting data. So I've worked with almost all the CEOs that came in, and I've stayed here and learned. As I was learning, obviously the school was in the UK, but I was always in Ghana.
Trying to do the research here.
I did the research here. And in fact, I've been part and parcel of the NHIS in Ghana. And like I said, I mean, I have a lot of publications to how we can remodel the NHIS. Not only that, in fact, I've been a consultant in also many countries helping. When I was doing my PhD, I remember in 2015, when we were transitioning from the Millennium Development Goals to the Sustainable Development Goals, my supervisor was advisor to David Cameron, who was the co-chair. So I had the opportunity to actually work with her and the team in trying to make sure that we put health at the center of the SDGs. So we noted that obviously health was actually captured, but well-being was actually missing. So the goal 3 of SDG actually talks about health and wellness. And the wellness part is actually what we need now across the world, looking at the disease burdens that are coming up in terms of hypertension, diabetes, the non-communicables. And I think that that is where Ghana we also need to be focused on. Currently, we fund most of the clinical conditions under the primary health care, about 95%.
Oh, I see.
Yes, of the primary health care diseases. We fund them.
Not partial funding, but complete funding?
Yeah, no, so 5% is not funded.
Okay.
So under the primary health care settings, we fund 95%, but 5% is not funded.
Okay.
So the 5%, we'll talk about it, but the 95% is mostly the clinical-based diseases, you see, but that is wrong, okay? So this is why, as part of my vision, I'm proposing that at least we should have what we call promotive preventive benefit package as part of our insurance scheme. Now, what is this promotive preventive benefit package? This promotive preventive benefit package is a package which will give, let's say, every Ghanaian an opportunity to have a health check just once a year on their birthday with a simple text message. What are you doing with that? One, you detect the diseases early so that they don't even get to its worst form. Two, you are able to, you'll be increasing life expectancy, because at the end of the day, when you screen and you categorize it under what we call the red, gold, green in medical field. So the red is where you need more attention.
Okay.
The yellow is where you put them on the borderline and monitor. The green, they are okay. So the green ones can be, it is not by accident that the advanced countries, they always send people text message, please come for medical check. In the media, you are there. One day you say, okay, this one is dead, this one is dead. Cardiac arrest, this. If they had screened to detect early and monitored, today we talk about emergency medicine, okay? People are just dying just like that. It means there is a missing link. Okay, so I'm offering, and I told Parliament, and it was agreed, that it is time we take the preventive, promotive. Our grandfathers told us prevention is always better than cure.
Yeah.
Why haven't we thought about it since the inception of the scheme? So that is what is missing in our scheme. So let's give every Ghanaian the opportunity to have a medical check. It doesn't cost much. In any case, let me tell you something. So we fund hypertension, diabetes, plus other diseases under the primary health care, as I've said. So when you screen them and you have diabetes, they are just going through the channel, the pathway treatment. When you have hypertension, they are still going through the pathway. So you do not, I mean, the cost is actually minimal in terms of its impact. So Parliament gave us 3 million to start with and give every Ghanaian the opportunity to have at least a medical check, which will help us to detect the disease earlier, to, as I've told you, increase life expectancy. And again, the key point there is also that it will increase membership by more than 50%.
I want to get that point clear. When is this supposed to start? Because the way you said the approval has been given, that means it's in appropriation. When is it supposed to start?
In fact, it's gone through the whole, the Parliament as a whole. They've approved it. They approved it before they left for this thing. So the good news is we are doing tariff adjustments. So currently my team is working with all stakeholders to come up with the new tariffs. So I've charged the team to include that in the new tariff arrangement that will come.
I guess what I'm asking is, when can I wake up tomorrow morning, assemble my entire family, and say that today is the birthday of some of you, so I'm taking you to go for that particular
Okay, so like you rightly said, it has just been approved.
Okay.
So the team is working on. So I'm hoping that maybe by May, if my memory says, because I've tasked the team to work, because it's one of my visions.
That's
and I
next month. May is next month.
Yes, but I'm sure the team will finish by next month.
Clarify.
You see, I'm sure that I'm putting emphasis on that. See, it's just been approved. In fact, it was approved just before they left.
They left for the break.
We've just received the report that we can go ahead with it. So the team that is doing the tariff review, which is the strategic purchasing unit, has been asked and they've been tasked to actually come up with this thing. The hospital. The good thing
on
is
the face of it.
No, wait.
Okay.
See, when I was in the Ghana Health Service, we started with what we call the wellness centers. Okay, so the holistic assessment of the Ghana Health Service now assesses the wellness centers in the various hospitals. At least we want all the district hospitals to have the wellness clinics. But what my proposal will not really need the wellness clinic, but it is part of, because that's a broader something that we talk of, because it will be different packages within. Then we secured funding from USAID, a project called Accelerating Social and Behavior Change Project, that's about $15 million for a pilot under our network of practice, which is currently being implemented by the Ghana Health Service. But that was just to be a pilot. But under the promotive preventive benefit package, I have singled out just one important thing that the nation needs: the medical check. And I'm saying that it doesn't take much to obviously do that. So whether you are sick or not, I'm giving you the opportunity to go to the medical, to go to hospital settings and just have your vitals checked. We will send you a text message. When it's, because we have the data, so we'll send you a text message. We have our membership, so we'll send you a text message to remind you. Just go to any health facility and check your vitals under that benefit package. Now, under what we call the Ottawa Charter, okay, point 5 says that we should reorient health services towards prevention is better than cure. The Ottawa Charter started in 1978, okay? Advanced countries, they've been doing it. The lower middle countries, we've not been doing it. So I'm saying that Ghana, we are starting.
I get your point.
Yeah.
Now, it's interesting, but there are a couple of things that ought to be clarified.
Yeah.
And on the face of it, it sounds like a very interesting policy.
Yeah.
But this is the Republic of Ghana.
Yeah.
We know that the devil is always in the detail.
Yeah.
And implementation has been the biggest problem with all the wonderful ideas that we have had over the years. First, we set out to put together what's supposed to be universal health coverage. Now, I was looking up the data, and the population covered by the NHIS rose to, in 2015, 41%. At the end of 2018, 36%. Then in the year 2019, it was 40%. Then the program-based budget suggests that in 2022, it was 57%. Presumably, 57% of our population are covered. Are these the one you are targeting under this free medical checkup, or anybody? Because health insurance is supposed to be mandatory. Someone, wherever you happen to be in the Republic of Ghana, you should have a health insurance program. You get my point?
I get it.
I'm asking whether you are targeting every Ghanaian or just those 57 or more. This is 2022. I don't know the 2023 figure.
So I'm targeting every Ghanaian. In any way, every Ghanaian do pay for the NHIS by indirect tax.
Yes.
So what I'm just saying, and it will help us to even boost our membership anyway. It will help us to boost our membership. So the fact of the matter is, because every Ghanaian pays for it, we need to also address the equity component.
That's true.
Okay, so whilst addressing the equity component, we can use the medical check. You see, bear in mind, it's not every Ghanaian who is sick. Okay, but I'm saying that let's start by screening the diseases under a package earlier for every Ghanaian to benefit from. In fact, this came in my research question, because Ghanaians were saying that they were not paying for the NHIA because they do not benefit from it directly. And I'm saying that with this...
Oh, you know that?
I know that.
I see.
And I'm saying that, you see, for them to benefit directly, let's at least entice them and give them at least something. And by that, they or the Ghanaian or Ghanaians will actually be interested and register. So when we are doing your medical check, what will happen? Will you not be interested to register?
So you have to register before the medical check?
No, you will do the medical check, but we will
still be registering.
Yes, because we have to provide you with health education to be able for you to register. We have to give you your rights and everything.
There's data that suggests that less than 1% are on private health insurance schemes. That means there's still a huge section of our population uncovered under our health insurance system. A very huge population.
Yes.
But that this requires monetary infusion. You get what I'm trying to say? Currently, we have always heard the NHI complain about money. I'm told that the last time you paid claims was in October of last year. Is this not an ambitious project that's still going to remain on paper?
You see, look at something. I think we are missing something. You see, now this brings to my second vision, okay? So when I came in, a conversation had been started with the NIA, okay, on how to integrate the data with NIA so that you can use your Ghana card, okay? Now, to achieve universal health coverage, you need every Ghanaian to be accessing healthcare at each point free, at least the primary healthcare, okay? Now, my proposal is that that integration is very good, but we need to go a step further. So we engaged NIA and we asked them, so when do you intend to produce cards for people between the ages of 6 and 14? They said it is work in progress, okay? Then we said that, okay, instead of us, NHIA, on our database, we have about 6.3 million Ghanaians between the ages of 6 and 14 that we're going to issue our card to. Our card costs between $4 to $6 because it's a biometric card. The NIA card, which is the Ghana card, costs about $6 and something, okay? So I said that, okay, it will be prudent spending to actually seed our money to NIA to produce the card for us as quick as possible. Now, what will this do? It will help us to achieve universal health coverage with ease. Why? Because if every Ghanaian can now access NHI with their Ghana card, okay, Ghana Health Service is now doing number at birth. So once we do this, we have covered the whole population. Now, let me tell you, the 15th and above, it's around 70, they've covered between 17 to 22 million. I don't have the figures, but I'm just giving this to you.
I get you.
You see, so if you look at it carefully, for us to achieve that universal health coverage, okay, with that, the adult population, it's going to be difficult. And the cost to get expired, people don't come to renew it and everything. So my proposal is that once we're able to issue that card, the Ghana card for the 6 to 14, we cover a chunk of the population. To add to the 15 million, the 15 and above, okay? Now, once you do that, it means that you now have to remove the financial barrier for, obviously, the fee that they have to pay to register. Because, like I said, people pay for it already. Through direct and indirect tax. Okay, you have formalized the system. So those that are paying the premiums will now you have a mechanism to collect the money because of the Ghana card. Okay. So with that, will you not achieve universal health coverage with ease? Because you are giving access to everyone. So the missing link is what I'm going to address.
I get you.
You see, and with that, trust me, and I mean, trust me, that is the formula to achieving the universal health coverage.
Except that when you posted it on social media, there was a quick response from Bryce Simmons, and I'll read to you specifically what he said. He says, "This is quite honestly the most porous economic analysis I've seen in Ghana," which is saying a lot. No one is going to impersonate a child on NHIA, not when packages are identical. So there is zero basis to buy a smart card for 81 Ghana cedis, not when a 2D barcode card at 2 Ghana cedi will do.
Okay, so my brother is good, but he's wrong, and I'm going to explain. You see, we are formalizing Ghana's system, okay? Like I said, now our main identification card is what? The Ghana card. You get what I mean? Our main identification is, so if you are now asking us to go to a 2D barcode, then you'll be living in the old age again. And again, so do you still want me to use the money, the biometric card? They are printing the biometric card for the NHIS users anyway, and we pay for it. So to me, it is prudent spending, okay, to seed our money so that we don't double spend. And again, let me tell you one thing. Our card lasts for 5 years. The Ghana card lasts for what? 10 years.
Is it not just because you made it so?
No.
When we decided as a country that we wanted to make passports last for 10 years from the 5 years, it was a policy decision.
No, but
why
again,
can't we do same with that?
No, but again, this is what has been happening. Okay, this is what has been happening.
I get you.
And so you don't want
but us to... But you see, you are cited as justification for doing this.
So you don't want us to integrate with the Ghana card. All countries integrate their cards with, obviously, their national ID.
Why should it cost you that much to do so?
For the NHIA card?
Yes.
Well, that's the cost of it because it's biometric. You see, and that card, you see, I mean, the fact is I'm looking at the benefits to the scheme. And like you rightly said, I want to use that to achieve universal health coverage. There's no two. If I use the 2D, it will be difficult for me to integrate with the Ghana card. And again, there's one thing. You see, I really want to integrate with LEAP, with the house registry, so that if you want to pull the data, you can just pull. So you see that in the UK, if we want people for social services, social benefits, okay?
It's easy.
It's easy. Why is it easy? Because of the single identification system.
But a very long time ago, we put together a common monetary platform.
You see. So in Ghana here,
yes.
If I want the indigents now, I now have to compare it with they have to register with me. I have to compare it with the LEAP data. I have to compare it with the house registry.
Yeah.
Okay. What is the point in carrying so many cards, my brother? What is the point? So, solution once and for all, solve it and let's move on. Because you see, now you may think that it is even expensive, but on a longer term, it will save Ghana money. See, these 2D cards that you are talking about, how long can we continue to print and print and print and print? My brother, we need a solution. We are in the digital age. Okay, so for me, I think we should solve this.
So you don't
once
think
and
this analysis economically is actually porous?
No, I don't think it's porous. You see, I think on a long term it will save, and I think it is forward thinking because, like I said, whether you like it or not, the cards, the NHIA cards were going to be printed anyway, and they've been printing it for many years. So me coming in and saying that, okay, yes, this is what you've been doing, but let's integrate with the Ghana card for us to easily have Ghanaians have easy access to healthcare using the Ghana card, and you don't want it. And I believe that from my field of specialty in terms of health, which Bright is not, would help Ghana achieve universal health coverage once we remove the financial barrier. My brother, it is the most wisest decision that I have taken.
When are we likely to achieve universal health coverage?
So I think we can, with what the plan, if it's followed
I'm actually
through.
About
Specific dates.
Yeah,
Look, it's supposed to be by 2030. That's the world. We are on course.
No, I'm talking about Ghana.
That's what I'm saying. No, well, Ghana is part of the world. So we've set a target.
When we implement what you're put in place, when are we likely to actually achieve universal health coverage?
I can think that from my thinking, I think it will be shorter than the 2030. But again, you see, you still need the models. You need to work it out, okay?
Because
it's not just...
I presume that we have worked out the model. That's why you know that these interventions are what will take us closer to it and help us achieve that.
So
I hope you get my point.
But the model is
mindful
easy.
Of your experience.
The model is easy. We want, what is universal health coverage? Universal health coverage is where all Ghanaians have access to primary health care.
Brilliant.
Okay, that's what I'm saying. So I'm saying that once you do the card and we have the number at birth, okay, you've covered whole Ghanaians. So now all you have to do is to remove the financial barrier to the people. And everybody can use their Ghana card too. You have achieved it.
I'm happy you've gone in there. It is perhaps one of the biggest problems with the entire, of course, with basically all insurance programs, all across the world, funding it.
Yeah.
We put together a funding scheme from National Health Insurance Levy some time back.
Yeah.
Of course, the people pay premiums too. A section actually pays premium.
Yeah.
The argument is that your funding sources are limited, they are not expansive, and they are making you pretend you are providing healthcare when indeed the reality on the ground is different.
Okay, thank you. So, like I said, one of my key things that I'm going to do is to provide the public with public education. You see, because we cover diseases under the primary health care, okay? And diseases under the primary health care are certain, okay? Now, in terms of the funding source, obviously, it can't always be expanded, okay, depending on where you are. But I can tell you that the scheme is sustainable. if only we stick to the principles of social health insurance. Okay.
I like the if
now,
only part.
Yes, yeah. Because I'm making a point. You see, like I've told you, it's sustainable if only we are able to do the promotive preventive, which obviously will detect the diseases. So on a long term, it will reduce the cost burden on the clinical claims. Okay. But again, you see, and this is where I also look at it and say, you see, we have multiple sources of funding in our system. Ghana Health Service, for example, do have, let's say, the public health division, okay? They have funding in the UK, okay? You see that the funds come through a system, then it's channeled through the various units. But here, we have multiplicity of the funding sources. So you have to look at it also in totality. In fact, I was telling them, my team, that on our formula, it says that we cover the claims is about 56%. But to me, if you do the analysis right, you may be wrong, because it's not, you don't have to look at it from the point that only what the insurance is paying for. You have to look at it from the other funds coming from, let's say, Global Fund. The other funds coming from, let's say, because Global Fund is the whole world's money that is being, you see, the grants that we get, the other things. So when you do the multiplicity of the sources, this is where you get the true picture of how much we are paying for our healthcare system. But whatever way you look at it, okay?
Okay, let me drill down to perhaps I'll make it. How much did you get from the National Health Insurance Fund 2023?
Exactly. So we, in fact, we got, I think, if my memory serves me right, I had a discussion with the finance minister just last week. But it's not to say that we've lost the money, okay? Once Parliament approves for you to spend, and you are spending within. In fact, last year was the only time that an additional 1.7 billion was approved to the 2.7 billion that was approved. So it went to about 4 billion. Only last year.
So
okay,
approved.
Approved. But you wait. You see, approved, okay? In disbursement, okay, the most important of the disbursement is the claims. Okay?
Yeah.
The most disbursement is the claims. As we speak now, we owe the lower tiers only 3 months, which is within the at 650. Okay? Not the current one. Not the current act. I'm talking about the old act, which was a convention that there should be 3 months. Okay, the lower tiers. The upper tier, we've paid up to October. So currently, we're going to have a meeting to see how best we can obviously clear it up to be within the 90 days. Okay.
Yeah, I was
the challenge we have now is not even the payments. Okay. The challenge we have now is not the payments, and this leads to my third vision. Okay. The challenge we have now.
Before you mention the third vision,
wait.
There's a question. I'll come to that. There's a question I asked about how much you have received compared to how much accrues into the fund.
I have to check. Like I said,
that issue is a very thorny issue.
I've just come in, but I have to check. But that's what I'm saying. That you see, for me, the crucial part of the insurance scheme, our core focus, okay, is the claims. Okay, and if the insurance scheme is actually paying its subscribers within 3 months for the lower tiers, we pay an average of 180 million every month. Okay? And I mean, we pay an average of 180 million every month. Cedis. Okay. To providers. Now, I've been engaging providers. Providers are telling me that, yes, we are happy with the payments, but there is a challenge. The challenge is the tariffs are inadequate.
Very low.
Very low. They are telling me that, please, review the tariffs. And when I started, I told you that there is a team. The Strategic Purchasing Unit is now reviewing the tariffs with all the stakeholders. Now, I plan, by my experience, to stop co-payments. Really? And it's a bold statement. I'm telling you, I plan, by my experience, to stop co-payment. How would I do this? I'll achieve this by obviously after the tariff review, okay, after the tariff review, the prices will go up. I will seek approval from Parliament to make sure that we do what we call the automatic price adjustments. We tie it to inflation. So in the UK, that's what we do. So there is a committee that will be set up. Immediately that the prices go up, the committee will sit up. And bear in mind, we can cover this within our allocation formula, because always you can have 30% excess in terms of what you have planned. This year we do have it, okay? So if I guarantee the automatic price adjustment like we do in the fuel field, okay? Now the problem will be that in Ghana here, things do not go down. You see, because people will, that's what, you see, so if providers are actually getting what they want, the prices that they get it, I believe that then it will be morally not right for them to be charging our clients under the 95% of what we cover. So there will be a moral conversation in this country too. And you see, at that stage, the media, this is where I will need you. Because at the end of the day, you will be the watchdogs to obviously look at the facilitator and say that, oh, this new CEO, when he came, okay, everybody was saying that the prices were inadequate. Mm-hmm. Now, he has increased the prices for you, which is covered in our 2024 formula. He has also guaranteed an automatic adjustment for you through a committee which they are part. I've met Ghana Health Service, which obviously is the major stakeholder. I've met CHAG, and they all agree to this proposal that I'm saying. It's not that we cannot, obviously, under what we support, we will be able to cover. So, you see, like I said, I'm very thankful to the president that he actually brought me at this crucial time, because this is my expertise, and it's really joyful when you are actually, you know exactly what you want to do. And I can be very ambitious and I can have the knowledge and everything. But again, if I'm using my knowledge and skills to help the country, and I want the stakeholders also to help me, when they look at the importance of what I'm saying, I'm thinking that every Ghanaian will come on board and support me. In any way, it is a crime to be charging what you are not supposed to. So we will bring all the stakeholders on board to support this agenda, because at the end of the day, the country belongs to us, and it's one Ghana that we have. We all want to support. We all want to help. At the moment, maybe I may have the opportunity and the knowledge and everything, the skills to do it, but I cannot do it alone. I need the whole society to support me. So we will try our best. And I can tell you that even as I'm saying that, I cannot do all. Because you come, you do your part, at some point, you exit, someone will come and continue.
When are you hoping that the co-payments will end completely?
There is a long way to go. Let me be honest with you. Okay, there is a long way to go. The fact is, you see, I mean, I'm just proposing this idea, okay? They are doing the tariff review, so let them come up with a tariff review. Let me now submit to Parliament in the mid-year that this is what I want to do, because they need to accept it. So once they accept it, then, so it's a long-term plan. It's not just a short one, because you cannot do it in a short term. You must be frank. Okay, you must be frank. It's a, you see, it's an,
is it the short to medium term? Are we looking at
a
year from now, no, 3 years, or a very long term from now?
Don't commit me in that manner, okay?
Because
you see,
I feel, and I agree with you that one of the biggest problems we have in the sector, Doc, is the co-payment.
You see, wait.
It defeats the purpose of no out-of-pocket at the point of service delivery.
I get
it. Defeats that.
Okay.
So if you have a plan to actually seize that, I am interested in how.
Are you happy with what the proposal I
no,
have? Wait.
It sounds like a very interesting one.
Exactly. Wait. You see,
yes.
In this country, have you seen this being proposed anywhere?
I've been told consistently we will end.
No, wait. But it's a new regime. It's a new idea.
Yes.
Have you heard any of the previous CEOs committing to this?
I have not heard anybody.
Exactly.
Say so.
And I'm telling you that by my experience,
yes,
by what I know, okay, I'm giving you a formula. But the formula will go through the processes.
Yeah.
Okay. So let's go through the processes and see how collectively, as a country, if we know that is the canker, then we all need to play our part to end it, with me being the champion.
Have we ended the conversation on capitation grant?
You see, It's one of the models of financing.
It was introduced,
wait.
Yes.
It's one of the models of financing. At the moment, I have not looked at the data, but I'm thinking that what I'm proposing will actually help the scheme.
Okay.
And I'm very confident that what I'm proposing will help. I've given you 3 key things. I'll come up with the last one, but I've given you 3 key points that, as a country, when we focus the scheme on, is going to change the dynamics, and is going to help us shape the scheme to achieving the universal health coverage even as quicker than the 2030, to end the most canker that we all say it is, which is the co-payment, to make sure that we are providing every Ghanaian to be inclusive in the scheme, to have at least a medical check, okay? And the last one has been provided in the non-Ghanaians, okay? The non-Ghanaians actually is very crucial. So again,
immigration help surcharge?
You wait. So again, I told Parliament that it is important that, you see, when visitors visit our country, there are 2 things that they are doing. We need to protect them, and they need to protect us as well. So we not covering them is actually a bad idea. So we have to have a medical insurance for our visitors coming in. This is very crucial. It has been missing for a very long time. In most countries, when you go and something happens to you, you have access to the healthcare settings. But in Ghana, it's not that. So I think it's an area that I want to, as soon as possible, look and see how best we can do it. The model, obviously, is my thoughts. We've not defined the model, but I think it's one of the crucial things that we need to do so that we protect. You see, when COVID came, people were just entering the country, okay? People were just entering the country, and under the Public Health Act, Ghana Health Service, the public health, we need to protect the citizens. And if you want to protect, if they were coming with an insurance package, we wouldn't have been charging people what we were charging there. You get what I mean? So it's a missing link. Like I said, my job here as an expert is to fill in the gaps.
Okay.
So with these 4 key points that I have, and which I'm happy every Ghanaian will be happy with, I need the support of every Ghanaian to champion this. And I believe that is going to revolutionize healthcare in Ghana.
The last question I have on the funding is to do with payment of premium. Do you have any plans of increasing premiums?
Okay, so you see, again, what is the contribution of even the premium to the formula? This year, last year, it was only 260 million.
Which percentage of the entire what?
Just some few, I don't know this thing, which I'll get it for you, but it's very little.
It's under 10%.
Yes, it's under 10%.
Okay.
So that's what I'm saying, that you see, we've not thought through carefully, okay? We've not thought through carefully. At the end of the day, the premiums is an informal sector that we ask them to pay the premium. So we need to formalize the system. And I'm saying, let's use the Ghana card to formalize the system so that we are able to obviously take a source, you see, or even remove that barrier completely. Because at the end of the day, you see, and I'm telling you that people pay indirectly. The people pay. The NHS is sustainable. See, it's just that you see, it's sustainable. I've been having conversation with the ministry. In fact, I've just told you the Minister of Finance is calling me. You see, when you come in with such interesting ideas, people really want to probe it and see how it will work, okay? And for me, I think that I cited the president when he even looked at my background and said, wow, where has the cost been all this while? You see, so let's just have patience and just, rally the whole country behind me in terms of the healthcare and see how we'll go. Because I want to use the all-society approach in solving this. The gaps are what I've told you from my end. I want to put it in and see how we all solve these gaps. And to be honest with you, Raymond, you see, it will go a long way to help us. We have overemphasized our healthcare on clinical. It is actually not right. In fact, in Kigali, okay, they are now doing tracks on roads. Why do you think they are doing that? They want a healthy population. So when the people are healthy, what will happen? The cost burden on our healthcare will reduce. In Korea, do you know they fund equipment in most of the facilities? They fund health equipment. And this leads to my dialysis thing that I told Parliament. Okay? So what is even preventing us as a country to say that we have to buy some medical equipment for some of our health facilities? What is preventing us? You see, people pay for it.
Can we start this conversation? Because I was coming to specifically that. These are emerging issues that have become very controversial. Yeah. First and foremost, NHIS does not cover dialysis treatment.
It's not part of our list.
Brilliant. Do you now have plans? Because we heard the ministry speak, we heard people from the office of the president speak, we've heard other people give the indication. When is NHIA as an authority making the NHIS cover dialysis? Is that the plan, or is just an interim, what they call a plan to support it in the interim? Okay,
thank you, Raymond. Again, I must be grateful to Parliament for accepting my idea. And I'm going to explain. You see, when I came in, there was a committee that had been set up to look at the actuarials, okay? To look at how sustainable it is when you add dialysis to our formula, okay? That committee has been working for some time now, because it's not just that you are just adding on diseases to our formula. No, that's not what we do. Okay. It goes through a lot of processes. First, the board will have to give you the green light, and after that, the committee with all stakeholders, then there's consensus. Then you look at it from the sustainability point in terms of the scheme. So when I went to Parliament, I told them that once the committee is working, and we had not received the final report of the committee, there is an opportunity in this formula. The opportunity is, let's reduce some of the areas and give me a seed money for me to engage stakeholders to support the needy in terms of the dialysis. Okay. So Parliament saw the wisdom in it. They granted me 2 million in our formula to start immediately with the stakeholders to see how we support the needy. Bear in mind, this 2 million is only an emergency fund. Okay. As we await for the committee's report and its impacts. Okay. Then in the mid-year, I can now go to Parliament and say, look, this is what the committee is saying. On sustainability, depending on what comes, it will be good. So please allocate some funds to us. Like I said, the NHIS is, looking at the monies that come in, okay, we now need to start to now begin to obviously focus. Initially, they were focusing on capital projects, which all countries do it. But over time, the capital projects will now come down, okay? But there must be new innovations in. Like I've told you, in Korea, they buy equipments for some of the hospitals. So if we want to buy, let's say, dialysis machines for, let's say, Kolebu Komfuanoche, so that it will reduce is it not brilliant? So, you see, we need to look at all these and come up with an appropriate mechanism in solving this.
Except that these are proposals. I'm looking at what realistically will be done in the next couple of months for the dialysis patients who have been complaining.
But I've just told you.
You're talking about the 2 million.
The 2 million, yes.
So now, if I go to Kolebu today, fresh or existing dialysis patient, am I covered under the 2 million?
Oh, but my brother, the formula has just been approved. I'm even yet to engage the finance ministry.
I guess what I'm asking you is, when do people get to feel the impact of this?
Within the year, people will feel it. But what I'm saying is that, you see, it's an emergency fund for the needy. So again, I have to bring the CEO of Komfuanoche, the CEO of Kolebu, and all the places that is. How do we deliver this money when even the Ministry of Finance make it available to us? Okay. You see, so this is what, because we would have missed that opportunity. How do we select
those who qualify to receive this treatment?
Because we would have actually missed that opportunity had I not made this proposal to Parliament. because that would have been mid-year. Then you see that mid-year when it's passed, then you are going to August, September. Then by the time you realize we are in December, then we are. So I think that, you see, for Parliament to agree with me on this, I'm so grateful because it has been very topical. So for me, it's like I think I've been very proactive in this, and I'm trying so hard to see how we support the needy. Okay, so just give me some time. I'll definitely, obviously, and I can even bring the media as part of the engagement on the committee, just because we all want to help. I mean, I don't want to see kids suffering from, but like I'm saying, there must be new innovations. We must channel our healthcare to innovations and see how best we can obviously solve some of these issues. But more importantly, if we go with the promotive preventive, I can assure you that it will be more holistic, and we will reduce some of these non-communicable diseases, some of these renal diseases. Okay, we will reduce the numbers. We will increase life expectancy. We will achieve universal health coverage. We will be addressing SDGs. Okay. You agree that most of it is also dependent on funds being made available to you, right? But the funds will be made available. Why would the funds not be made available? Over the years. The differences between we have always received our money. It's just that with respect. Okay. The differences between allocation and actual monies received has been something that your predecessors have complained about. Or if you say my predecessor, who? Which of my predecessors have complained about? Okay, so I know that when we came in 2016 or 2017, thereabout, the previous regime, which is the NDC, was owing about 1.2 billion, which was cleared by the Nana Addo Bawumia government. Since then, okay, it has been consistent. Like I'm saying, there is a focus that this government has actually been, the claims have actually been paid. I've told you that we owe. So how much debt do you owe now? Wait. I've told you we owe up to October, which obviously is okay. We just need to do more. The lower tiers we owe up to December. Yeah, we owe up to December. What's the at 650? Is it 650? Yeah, what is it saying? It's saying that within 3 months. 90 days. No, yeah. But 90 days is what? 3 months. No, but wait. My point is wait. But even the new act, yes, it even takes that away. So that's what I'm saying, that if we now start to move into the new regime, where I'm saying that if we have the Ghana card, which we have formalized. We now have obviously the automatic adjustments, if agreed to by Parliament. Okay. We'll be getting closer. In terms of quantum, how much do you owe today? If you say how much do we owe, are you talking about how much do we owe in terms of our capital investment, or how much do we owe in terms of our claims? Because for our claims, like I said, for me, for the lower tiers, we are on course. We are on course because we don't owe anybody in terms of the lower tiers, except those that we've not validated, those with challenges. And you can go. There's what we call the sunshine. There's what we call the sunshine policy, where you can assess from our website the people we have paid. Yeah, I mean, just Raymond, let's try to change the narrative. You as a journalist, you have not told me there's that amount. Wait. And if I may press you further on it, I've just told you that. Yes. I've just told you that I know that where we lower tiers, we don't owe them anything because we are within the schedule. They are within the schedule. How about the other amount of money involved there? That one we owe 2 months. We owe November, December. And how much is that? In fact, I don't have the figures off head, but I see. Is it but if someone like we used to hear some time ago? But if someone has been able to pay you from January to October, and we are owing 2 months. Just for Raymond, just be honest with yourself. No, I'm just asking questions about how much is involved, because we know what happens in this state. Let's say whichever happens when let's say this government leaves office and the next government comes, like what happened in 2016, we'll be told that there's a huge debt in the sector. This huge debt has not been cleared. We have made promises to clear them. That is why, for many people, and we have just discussed how the financing affects the scheme itself. I hope you get my point. I get your point. I know I get your point. That's what I'm saying, that this one is not about any government coming to power to probe anyone, or just look on our website. Okay, it is there. It is there. Even I can tell you today, I'm on the front page of another newspaper who went to the website to check that we have paid 180 million. Okay, it is on the website, so there's transparency. And I've admitted that we owe 2 months for the higher tier, which is November, December. So again, let me say this. You see, we do not just pay facilities, okay? I mean, you cannot just pay facilities. One, we need to make sure that we are not paying facilities in a fraud manner or in it. So we validate. So unless our CPCs are convinced that obviously you've ticked all the boxes, we will not pay.
Is there a potent system now? The validation.
Yeah, the validation. Yes. So if you hear some people saying we owe them, the first question you should ask is, what is wrong with your claims? That's the first question. Of course, because you see, now I hear this. I mean, I was amazed when I like reading, Papa. So when I came, I've taken all this weekend, I can take you to the back. See, I've read most of the things happening in the scheme. On my table, people petitioning, people this. See, so the whole weekend, from Friday to last night, I have been here. All I'm doing is that I just want to get...
Have you identified fraud?
No, wait, it's
Have
not...
Wait.
I'm
just asking, since you approve the figures, I want to know.
Wait, you see, look...
I want to hear bold declarative statements from you.
You see, the system actually takes care of that. That's why I'm saying that. The system takes... So, on our verification, if you do double claim, we will catch you. That's why, you see, that's why I'm saying that when the providers are saying that, you need... Because I've engaged them, okay? I've engaged them. There may be challenges. I'm not saying that there are not challenges. That's not what I'm saying. I'm just saying that in spite of the challenges, the current NHIA, okay, is putting systems in place in such a way that we meet our obligations. And meeting our obligations means that we are transparent to every Ghanaian. We are transparent to the providers in such a way that when they go to our website, the information is there. If they've not received the payment, obviously, they have a way of submitting it. But the digital agenda is working. It's working in such a way that there is now verification of the claims. So if we've not paid you and you think you've done everything right, then follow the processes. We will pay. Because as for the claims, the Finance Ministry have made it clear that they are giving us our money. And that's why it is also interesting to know that we only owe 2 months, November, December.
I get you.
Because, yes.
Is there a need now to explore other options, let's say, of financing? Is there a need? Are you looking into those ones too?
I think you have a point. You see, there are some things that could threaten the scheme, and now I'm coming to the challenges. You see. The request for people for us to add on things that we do not cover. Okay. That's why I'm saying that as a country, let's look at the components of the primary health care and look at what is missing so that we rather reduce the burden from there rather than just people saying, add on this, add on this, add on this. Okay?
Childhood cancers have been raised. Other issues to do with cancer treatment in general. Other people have actually talked about why not what they call it, the very things like we talked about the renal care, the elements of having dialysis care taken care of. The proposals are coming because they say these are threatening issues. Non-communicable disease is also become a very big issue in the Republic of Ghana. To what extent will the person, for example, with elevated blood pressure be able to get help? Would this X-Forge 320, whichever combination, be automatically paid for by the NHIS? Should he expect that the regular care that he needs of his kidney and the other things, if I wanted an MRI today, should he also be covered? Those are issues people are raising because they are emerging issues that have become more topical. Are you able to shoulder all of them? Because there's a limit to which you get the money and how much you can put it to.
So, number one, this is a social insurance scheme. Okay. This is why I talked about it being threatened by, in the UK, okay, you pay for prescription.
Yeah.
Okay, you pay, but basic ones are covered.
Yeah.
Okay. So we just have to look at the models. That's what I'm saying. I gave you some innovations around this. I think what is missing, and I will keep emphasizing every day, what is missing is that we've not addressed all the primary healthcare components. And now we should look at the promotive preventive benefit package to reduce the cost burden. Okay. And once we are able to do that, the scheme will be sustainable, and we'll be picking most of these things earlier than. And we should also look at innovations for, let's say, the courier models where the insurance buy equipment actually for some of our health facilities in trying to reduce the expenditure of the patients or Ghanaians. You get what I mean? And with these, I'm sure that we just need further discussions on and see how it will work. These are, like you said, these are proposals, and it will only take experts to actually deliberate and see the way forward. In fact, we came up with a scheme in 2003. Of course, it's been 20 years now, which we are celebrating. So is it time for us to now sit back and say, okay, now there's pressure in everybody saying, add on this, add on this, add on this. And over the period, we have invested in infrastructure infrastructure in terms of the systems that we have to put in place. Is it now time for us to wind down, start to now come down, so that we can now put, these are conversations we need to have. Okay. So in my short term, I'm prepared to start the conversation. Okay. But let's see how best we use the all society approach in solving this. Okay.
My last question to you. Your time in office, what do you think will be your legacy? A single most important thing that no matter how long this scheme survives, everybody will say this was a Da Costa project.
Making sure that the 6.3 million Ghanaians on our database do get access to healthcare by they having the Ghana card. 2, advancing universal health coverage. That's number 1. Number 2, making sure that we do have the medical check, which we call the wellness package, as part of the scheme to complete the primary healthcare pillars within. 3, making sure that the visitors coming to this country, the policy has been launched, all right, but I want to see to its implementation. Visitors coming to this country actually do have medical insurance in a designated facility.
I am most grateful to you, Doc.
Thank you.
And I wish
so
you all
much.
the best. I mean, in your time,
Thank
we
you.
shall be probing it. I shall consistently be coming to you to see how far with this particular project, for example, have you been able to deliver on it?
Thank
well,
you.
I wish you all the best.
Thank you, Raymond. Thank you. Well done.
Well, folks, that's where we end today's edition of UPfront. Many thanks to you for watching.